Hi everyone, today I'm here with Dr. Chu, a urologist in the area. And first of all, before I go into more of the details, I just want to say thank you, Dr. Chu, for being with us today.
My pleasure, Adnan.
Okay, so before we dive into more of the kind of like the finer details of urology, could you just give us a brief overview of what the specialty is? What is urology?
Urology is the practice of surgery, but not just surgery. There's medical and surgical practice of the urinary tract, the male and female urinary tract. That includes the kidneys, ureters, bladder, and the urethra.
Stepping back, why did you choose medicine and urology in particular?
I chose medicine because I felt that I would like to help other people. I chose urology because when I was in medical school, urology had a very, very strong department. And I felt that at that time, when I was in medical school, there were still a lot of questions which were unanswered. Urology was able to answer many of the questions that I had.
Was that related to more of like personal things that you were, questions you had, or more about the science of medicine that it answered?
I think it had more to do with the science of medicine. You know, when patients come to you and they have questions, okay, I feel a little inadequate if I say I don't know or we don't have the answer to that. Again, in urology, we had many of the answers to the questions that the patients were asking.
Interesting, because usually you often hear that internal medicine is where the more of like the cerebral kind of aspects of medicine are, but I guess urology has some of that too, huh?
Well, no, what I meant to say is medicine continues to expand. They continue to do a lot of research. We continue to get a lot of answers. We continue to find out a lot more things so we can cure a lot more diseases, okay? When I went to medical school, 45 years ago, all right, we had a few answers, but not an awful lot. And I thought that I would like to have some good answers for the questions that patients had. For
urology, you match into that right after medical school, correct? Or is that a subspecialty? Or is that a specialty?
Okay, way back when, okay, this is 40 or 45 years ago, there was a match, but the match was nowhere near as rigorous or as complicated as it is now. My story is that I went to medical school. I came up to UC Davis for internship. I did what was called a rotating internship. So a rotating internship allowed me to get a little bit more experience in all of the fields of medicine. So I had rotations in pediatrics, medicine, ICU, and the surgical specialties. It was my internship year where I really fell in love with urology. In medical school, again, urology was a very, very strong specialty in my medical school. And I aspired to it, but I didn't know whether I really wanted to do it and whether I could do it. In my internship year, I really fell into urology, and I felt I could do a good job in urology. So I spoke to the chief of urology here in Davis, and I got accepted into the program. So again, while I understand that things are quite a bit more complex and more complicated, for me, it was much simpler.
Going off of that, do you have any tips for students to match into urology based on your experience?
Because of how difficult it is now to get into urology, and I understand urology is one of the more difficult specialties to get into, if you know you're going to get into urology, okay, when you're in medical school, try to find a mentor who is a urologist. Try to find somebody who can help you get into the specialty. Okay? If you're not sure that you're going to go into urology, I think go into a surgical specialty and see if you like surgery. All right? If you go into a surgical specialty and you like surgery, but maybe not urology, you still have all the other surgical specialties to fall back to. And yet, if you go into general surgery and you still don't like surgery, I think you can still fall back and go into internal medicine, family practice, or even OBGYN. So I think that keeping all your options open, if you're not certain about what specialty you want to go into, keeping all your options open is your best option.
So is it hard to switch residencies once you're already matched into one?
For the more desirable specialties, it is probably very difficult to switch. What do I mean by the more desirable specialties? In the surgical specialties, probably to get into orthopedics, urology would probably be difficult to switch.
Okay, so you can kind of move from more competitive to less competitive, but not the other way as much.
Right.
Okay. Before we go into more of the specifics, are there subspecialties of urology, or is it just one kind of thing, like other fellowships?
Yeah. Let me first tell you that if you're wondering about urology, okay, you can go to the American Urologic Association's website, which is AUA.net. And they have a portion of their website devoted to medical students and to residents. So let me just go over a little bit about what's in the website. Okay, it asks about urology. So urology has several different subspecialties. There is pediatric urology, urologic oncology or urologic cancer, renal transplantation, male infertility, calculi or urinary tract stones, female urology, and neurourology, or the area of urology that interacts with neurology. So there are several subspecialties of urology.
And what are some typical cases that you see in a day in urology?
Since I'm now retired, I don't see. I'm just doing some volunteer work. But I can tell you a very interesting case is a patient that I just saw a couple of weeks ago. All right, she had a younger, middle-aged female who had multiple problems, multiple symptoms, and she was going to see several doctors, and she didn't have a good answer because of an interest of mine in something called interstitial cystitis or chronic pelvic pain syndrome. All right, I came quickly to what I thought was the diagnosis. She looked into it and she felt that that was, in fact, her correct diagnosis. So it depends upon what interests you have.
Okay.
All right. I had no subspecialty in urology. I liked all of urology, and on any typical day in urology, I'd see many of the subspecialty areas of urology. For sure, we'd see kidney stones. We'd see cancer. Okay, I'd see patients with neurourology problems. Now, here in Sacramento, there are a couple of pediatric urologists, but 5 years ago, 10 years ago, I'd be seeing pediatric patients too. So in general urology, we see a lot of different aspects of urology. And that's what made it especially interesting, because you'd be seeing a whole bunch of patients with a wide variety of problems.
Okay, and so when you were practicing, what would a typical day in your life be like?
Well, a couple of days a week, I'd be doing surgery. And the surgery would vary from stones to cancer. With regard to stones, all right, there would be non-invasive procedures such as extracorporeal shockwave lithotripsy, or ESWL, where you take a machine that focuses shockwaves on kidney stones. So it's a non-invasive procedure, and you break stones using shockwaves into smaller pieces, and the patients pass small fragments of sand. Okay, you can do invasive kidney stone surgery. Cancer, prostate cancer is the most common cancer in men, so we see a lot of prostate cancer. Bladder cancer is the fifth most common cancer in males and females. Okay, it is also the most costly cancer to take care of because there's a lot of follow-up that's necessary, and it's procedural follow-up, which is somewhat costly. Kidney cancer is about the eighth most common cancer, and there are many different techniques on doing that. We could do non-invasive surgery, such as ESWL. We could do endoscopic surgery using our scopes. We could do open surgery. We could do laparoscopic surgery. We can do robotic surgery. So again, urology involves a wide spectrum of non-invasive procedures as well as invasive procedures.
And on your surgery days, what would your hours be like as opposed to maybe your clinic days?
On surgery days, we usually start surgery at 8 o'clock and we finish 4, 5, 6 o'clock. Okay. On clinic days, we'd start at 9 o'clock and go to 5 o'clock.
Comparing this specialty to the lifestyle of other specialties, do you feel like it's perhaps a little bit more lifestyle friendly than some of the other surgery specialties?
What I liked about urology is that it involves a wide spectrum. You could see patients from children to older patients. You do have middle-aged patients, which several specialties don't have. Okay, you can do surgery. You have the non-surgical aspects of urology. Okay, so there's a wide spectrum. So again, what's great about urology is you see a broad spectrum of patients. In terms of lifestyle, I think urology allows a very reasonable lifestyle for whoever goes into urology. Okay, you can work as hard as you want. You can work not so hard. Okay, I know some physicians, some urologists who did only kidney stone surgery. Okay, the problem with kidney stone surgery is depending upon how many patients you want to see at night. But kidney stones is probably one of the few urgent situations where you may have to be called into the emergency room occasionally. But if you could tailor your practice so that you don't have very many urgent or emergent cases at all. Urology typically does not have very many true emergencies where you have to go into the emergency room and face a very, very emergent situation. Okay, so I think the lifestyle of a urologist is fairly good considering the hours that you put in and how often you have to be awakened in the middle of the night to go in to see patients in the emergency room.
So is there usually no call?
No, there is call. And you may get called into the emergency room occasionally. But typically you're not called often, and it's not a life and death situation in the middle of the night.
How do you recommend new physicians in urology pursue other avenues like research or policy work or perhaps mentoring students besides their clinical practice?
It's another thing about urology. I think that urology allows you the time for you to devote to other interests. There have been many of the past presidents of the American Medical Association have been urologists. Another interest of mine was in blood banking. So I was at one point chairman of the board of the local blood bank here in Sacramento. If you have other interests outside of urology, outside of medicine, practice of urology, I think, allows you to devote some time to what you love.
Makes it a flexible kind of
lifestyle.
Yes. Are there any types of personalities that do best in urology?
I think to be a good urologist, you have to be somewhat compulsive because you have to try to do the best possible for your patients. And I think if you're very compulsive, you can do a little bit better.
And what's the most challenging aspect about urology?
I think what's challenging about urology is that so many areas of urology cross boundaries. So you can't say, I'm a urologist and I will only take care of urologic problems, because there are many areas of urology that cross boundaries with other specialties. For example, kidney transplantation. When I was in my residency, we did kidney transplants. We took care of patients postoperatively. So we had to take care of all of their medical problems too. Pediatric urology, you have all the problems of children, and you take care of them medically and surgically. Neurourology, a fairly new and growing field. One of the better treatments for patients with Parkinson's is putting electrodes into their brain. Urology uses a very similar device to put electrodes into their low back to help the patients who have intractable urinary frequency and urgency. In other words, patients who have to go to the bathroom very frequently and who may be incontinent of urine may find the neurologic device implanted in their low back to be of great benefit. So again, the urology crosses many boundaries. So I think that it allows you to keep touch with all the other specialties, and the other specialties interact with urology.
On the flip side, what's the most rewarding aspects of urology? I guess it's a challenge, but it's also rewarding. Would you say that's the most rewarding aspect too, or?
That's a great question, Edmund, because I love urology because we get to follow the patients. Okay? Cancer patients, prostate cancer, bladder cancer. Okay? As a prostate cancer, you get to follow them because prostate cancer is a fairly slow-growing cancer, and you need to follow them for 10, 15, 20 years. So you're following these patients for many, many years, and many of them are so grateful for what you've done for them. Bladder cancer patients, bladder cancer recurs frequently, so you have to follow these patients for a long, long time. All right? So again, you're able to follow these patients, and that's what I love about urology. All right? These new neurourology patients, these patients with these devices that we're implanting in their back, all right? Because they're battery operated, you do have to see them, and you have to, little toys to play with, so you check the programs, you check the batteries, and the companies keep on coming with slight changes, slight advances, new changes to their programs for these devices to allow the patient's quality of life to be further improved. So again, you get to follow the patients, you get to see if you can further or better improve the quality of life that they have.
So it's a nice blend of surgery and long-term care.
Yes, yes.
So how well are urology physicians compensated? I know you mentioned there's a variability in how much how much work you want to put in, and how many patients you want to see, like the breadth of patients you want to see. But in general, how well are urology physicians compensated, urologists compensated compared to other specialties?
Although I haven't paid close attention to this, in the information that I've read, all right, urology is probably among the top 5 surgical subspecialties in terms of compensation. So I think considering the fact that you have a very good lifestyle, you have time to devote to other interests, okay, I think that the compensation that urologists receive is very adequate and very satisfying.
And do you have any tips for physicians to manage their finances well in residency and also when they get out and they start making money?
This may sound like a joke, Edmund, but have a good spouse. No, I think that enjoy yourself because you're young only once. But keep in mind that you can also enjoy your older life, your older years also.
So it seems like a lot of people nowadays just tell you to keep saving and not really spending money, but then I feel like you end up also missing out on some of your youth, especially in medicine, where you're already, compared to your peers, like studying all the time and training all the time.
You're absolutely right, okay? And that's why I say, you're young only once. Enjoy yourself.
Hard to do, but...
But again, as you said, urology is a fairly well-compensated specialty. So while don't go out and spend all your money, okay? Enjoy yourself. Just be reasonable.
So it seems like nowadays most physicians are starting to work in groups in hospitals, big hospitals, things like that. Is that the same in urology, or are there opportunities to do private practice or other types of employment?
I think urology is following other specialties, and becoming an employed urologist is probably the trend. But we're not leading the pack. I think we're following the pack. Depending upon where you practice, if you're in an urban area on either the East Coast or the West Coast, you'll probably be joining a large group. If you're in the middle of the country, you could go into fee-for-service as an individual.
It's very location dependent.
Yes.
And so you mentioned that urology covers a lot of things, and it's not just the urinary tract system, it's also it deals with like nephrology, neurology, all these other things. How would you recommend people stay on top of their field if they do become neurologists?
Continuing education, keep a wide breadth of interests.
So would that be like through conferences or like classes online, or?
Different people learn in different ways.
Mm-hmm.
I think that subscribing perhaps to the Journal of the American Medical Association, subscribing to one or the other cancer journals, okay, if you're broad interest in cancers, I think will allow you to keep up with all the changes that are going on in medicine.
Because I'm sure getting into urology, since it seems like a great specialty, is very competitive, and even in residency, like all residencies are very intense, and having to do like surgery and also long-term patient care just adds up. How would you recommend preventing burnout?
Preventing burnout is a multifactorial problem, and I think that if you have other interests that you can spend some time doing, other interests such as painting, jogging, anything, all right? Family, spouse, if you like to do politics, if you want to do other things, do the other things so you're not focused only on one small area. In this case, urology. Do other things. Keep other interests. Participate in the breadth of what's around you.
And then for work-life balance, you mentioned urology is a little bit more conducive to having that. Are there any tips in particular you'd recommend for us to establish that more, like especially once we, I guess in residency when it gets more intense, and also in once we actually finish residency?
Even in residency, all right, keep your mind, keep your eyes open. Do other things with your fellow residents. Go do other things. Okay, play card games. Okay, go places, do things. Okay, keep your other interests open.
Were there certain things that you perhaps like scheduled to have like weekly or monthly or something, or is it just like whenever you had free time you just tried to do something different?
When I was a resident, there was one guy who was really, really egregious. He was just very, very outgoing. So once a month he just scheduled get-togethers, and we just got together and did different things. It would be here in Sacramento because the weather is really good during the winter. During the summer, we'd have picnics. Once in a while we'd go up skiing, okay, as a group, as an individual, okay? Just do other things. Once another spouse of one of the residents got a group together, and we were talking with a professor from UC Davis. What's great about Sacramento is there are a lot of things to do, and it doesn't cost you a lot of money. So take advantage of what's around you.
Okay.
Do things. Do different things.
So that's another reason why you should find a residency and scope out what residencies have like a good location for the residents that they attract, maybe like the activities that they have around them, things like that.
Absolutely.
If you had to go back, would you choose the same specialty again?
Yes, I would.
Is there
I loved
anything you
urology.
changed?
Okay, that's not to say that I wouldn't have loved other specialties, but I'm very pleased with the decisions I made. Okay, I was very happy that I went to urology. I'm happy that I came to Sacramento. I'm happy. Okay, you've mentioned money. All right. We saw our financial planner a couple of weeks ago, and they said that we don't need to worry about money. All right. The money will outlive us. That's great.
It's very freeing.
Yes.
Well, on that note, would you recommend us hiring a financial advisor, or are there certain like investments that you recommend us going into? Or
A very interesting question. I think that you should adopt some frugal lifestyles when you're younger. Put a little bit of money away. Again, enjoy yourself, but put a little bit of money away. Because of compounding, saving a little now will become a lot in the future. Okay? But again, enjoy yourself too. And, if you're going to have a family, spend the money on the family. You will never be sorry about spending money on your family.
So how has medicine changed since you started, and where do you see it going in the future? Any big changes that you see in the next few decades maybe?
Medicine has changed so much, all the way from cardiology. When I was a medical student, most commonly prescribed drug was digitalis. Now they don't even use digitalis. Okay, invasive cardiology was not a specialty, did not exist. ICUs were just starting now. Okay, they're not just ICUs. There's medical ICUs, surgical ICUs, neurosurgical ICUs. There are hospitalists. Okay, medicine continues to change. Oncology, tremendous changes in oncology. Hopefully, the degree of change that has gone on in my lifetime, okay, I hope continues in your lifetime. So I think if that's the case, I think that there will be very few unanswered questions in medicine by the time you retire.
Hopefully.
Mm-hmm.
Okay, so do you see any big changes on the horizon? Like, I know, like, for example, EMR dramatically changed, like, medical, like, how medicine is done. Do you see anything in the future that may be kind of similar to as drastic of a change as EMR?
I think you're seeing genomic medicine
Mm-hmm.
take over, all right?
Mm-hmm.
And who knows, someday, soon after you're born, you can have your genes analyzed,
Mm-hmm.
and they can predict exactly what's going to happen to you. And with, who knows, with CRISPR techniques, you may be able to change your future. I don't know whether that's desirable, but...
It reminds me of some old movies, like, I don't know if you've heard of Gattaca and others where kind of seem like that. I guess it poses a lot of, like, ethical and other issues as well.
Right.
But perhaps we'd be in better health overall.
Mm-hmm.
So last question actually is, what advice would you give to medical students to become good doctors?
Realize that you have been blessed to become a doctor. You should be proud, but humble. People are trusting you with the most intimate aspects of their life. Accept it. Keep all of their secrets. And be as honest with your patients as possible. Be true.
Great advice. Thank you guys for watching. Thank you again, Dr. Chu, for being with us. Let me know down below in the description box who you'd like me to interview next. Thank you guys again for watching, and have a great rest of your day.
Thank you.
Thank you again so much.
My pleasure.